Thank you, Mr. Speaker. Mr. Speaker, earlier this week, the Health Minister said he only knew of one doctor who wanted a public inquiry. It's disturbing that someone on Treasury Board just can't seem to count. In fact, 6 AMA sections representing 2,500 doctors have called for this inquiry, 2,499 more than the Health Minister's estimate. Emergency medicine, addiction, anesthesia, internal medicine, pediatrics, and rural family medicine have all called for this inquiry. To the Minister, with such a growing number of doctors asking for this inquiry, how many more will you ignore
The Honourable Minister.
Mr. Speaker, I'm glad she asked this first part of this question because I don't recall saying that he's the only one I've heard of. I recall saying that Dr. Garbutt's letter was the first one I was familiar with in writing. Now, there's chances are there are others who are out there, but I think I've already answered many times. I could repeat it again. I could risk being called to order for repetition, but people are quite comfortable, I'm sure, with the Health Quality Council's approach, and let's give them a chance. They have to be given an equal chance to do what they've set out to do.
The Honourable Member.
Mr. Speaker, there's two worlds, his world and reality. Thank you, Mr. Speaker. Given that the Health Quality Council simply can't provide the level of legal protection our doctors want, something that has been pointed out to this government over and over, how much longer will the Minister continue to use this excuse to not call a public inquiry?
The Honourable Minister.
At this time.
Mr. Speaker, no one is using any excuses whatsoever, but if you'll indulge me, I'm going to read the Alberta Evidence Act. It's about 13 pages long. I'll read the whole thing if you'll allow me. But in particular, let me just quote Section 9, sub 5. Neither the disclosure of any information or of any document or anything contained in a document or the submission of any report, statement, memorandum or recommendation to a Quality Assurance Committee for the purpose of its quality assurance activities, nor the disclosure of any information or of any document or anything contained in a document that arises out of the quality assurance activities of a Quality Assurance Committee creates any liability on the part...
Minister, thank you very much. The Honourable Member Calgary-Fish Creek, if you can be, and I hope you'll be heard.
Well, what's amazing to me, Speaker, is he thinks this is funny. Will the Minister at least admit the only reason he's not calling a public inquiry is because it will confirm what we all know, that the government has used fear and intimidation to hide the truth about our healthcare system?
Honourable Minister.
Mr. Speaker, I don't know what the allegations were back in 05, 06, 07, whenever that was. What I can tell you is what's going on today. Today, there's a much healthier relationship. And as a result of the meetings with the Premier on Friday and myself, we're going to strengthen that relationship with AMA. That's why a news release was put out on Monday, and that's why the President of AMA put out a letter yesterday talking about strengthening the relationship between government and AMA, and in turn between AHS and the doctors serving in the system, and that will happen.